Good morning, parents. How are you all? I hope you are all doing very well. So, today is day 7 of my 21-day challenge of going live. And this morning, it's going to be a little bit of a shorter video. I'm going to be talking about the management of baby Snuffles. Now, Snuffles in babies is really very common. And the main reason being is that babies' nasal passages are really quite small compared to adults. And babies, when they get a buildup of mucus in their nose, it becomes hard, like plaques. And they can't pick their nose like we as adults can, and they can't blow their nose either. So it's really difficult for them to clear their airways. Now, this can cause problems all year round, actually, because in the summer we have very dry humidity, and in the winter times we use central heating, which can also dry up the mucous membranes. So my top tip is really to humidify the air in the bedroom that your baby sleeps, and you can do this quite easily by just putting a bowl of water in their room. It will help to just add moisture to the air. Now, another top tip is that you can use saline nose drops. Now, saline nose drops you can buy over the counter in any pharmacy. And what you need to do is just put 1 or 2 drops into each nostril. And this is particularly useful before a feed, because babies are mainly nose breathers, and when they are breastfeeding or bottle feeding, this can be problematic because obviously they're going to be blocking their airway when they're feeding, and this will cause them a lot of frustration, because what they will do is keep coming off the breast or the bottle to get air. But you see this much more in breastfed babies because the nasal passages are so close to the skin. So I would always recommend that you put the saline nose drops in prior to a feed, and that will help loosen the secretions in the nasal passages. Now, babies will either swallow them down. Now, don't worry too much. If they do swallow the secretions down into their tummy, it's not going to do them any harm at all. But they can also sneeze them out, and that is perfect solution, really. I would advise you not to use any kind of medicated things to deal with snuffles. However, aromatherapy oils can work quite nicely. So things like eucalyptus is really good at opening up the airways. And what I used to do is put just a couple of drops on a muslin or a handkerchief near the baby's cot, not in direct contact with the skin ever, because it will be an irritant. But eucalyptus is excellent aromatherapy to open up the airways. Lavender is also very good to help them sleep. A lot of parents used to ask me, can they use things like Vicks rub? And I would advise against that. Vicks is quite harsh on babies, and I would avoid that. But there are other things on the market that you can buy, like Snuffle Babe, but always follow the manufacturer's guidance. I prefer the old traditional ways of managing any minor ailments in children. It's natural and it's cheaper, of course. So if your baby does have snuffles, do try and sleep them on a head up tilt. So by that I mean roll a towel or a muslin or pillowcase underneath the mattress so that your baby is not lying flat down. It's always much harder for them to sleep if they have a blocked nose. If they are Sorry about that. If they are lying flat down, they find it really hard and a bit of a struggle to sleep. Whereas if they're on a head up tilt, that helps them a lot better. Now, during daytime naps, it's okay if they have Snuffles to sleep in a car seat or a pushchair while they have the Snuffles, but I wouldn't recommend it as a long-term solution. It's not great for small babies to be lying in a pram or pushchair or bouncer even, because the spine can curve quite easily. But for short periods, it's absolutely fine. So don't worry about that. So that is my top tips on the management of Snuffles. If you find that your baby is getting a high temperature, or the secretions from their nose are turning yellow or green, or your baby is going off their feeds completely, then it's time to see your GP, because there might be an underlying problem going on. And sometimes Snuffles can go to the upper respiratory tract and cause some problems with your baby. In most instances, again, it's going to be viral and it will last 10 to 14 days. But if there's any sign of a bacterial infection, it will need treatment, and your baby will show signs like going off their food, high temperature, being irritable, or off form. So that's the time to seek medical attention. Okay, hopefully you've enjoyed my tips today on the management of Snuffles. Please do give me a comment or a like. Tomorrow I will be in my business page and at 7:30 a.m. BST, and I will be talking about things to do with the mouth. So tomorrow I'm going to be talking about oral thrush, and if I have got time, I'll talk about tongue tie and lip tie. If not, I will talk about those on Friday. So until then, happy parenting and have a great day, everybody. Take care. Bye bye.